A very pleasant good afternoon to one and all, and sending across greetings from Father Muller Homeopathic Medical College, Mangalore. I cordially welcome you all to Ignite 2022, a webinar session as a part of the CME activities organized by Department of Homeopathic Medica of Father Muller Homeopathic Medical College, Mangalore. Now, I invite Dr. E.S.J. Prabhukiran, Principal, Father Muller Homeopathic Medical College, to deliver the welcome address to the delegates online. I invite Dr. E.S.J. Prabhukiran, Principal, Father Muller Homeopathic Medical College, to deliver the welcome address to the delegates online.
Good afternoon to you all, and welcome to Ignite 2022. This is an innovative practice of the Department of Materia Medica as one of the continuous medical education programs of the college. I congratulate the department, and at the outset, I would like to thank our administrator, Reverend Father Roshan Krasta, our assistant administrator, Reverend Father Rohan Dias, and the management of Father Muller Charitable Institution in general and Father Muller Homeopathic Medical College in particular for encouraging us in every activity that the faculty take up. This webinar is one method that we started, or we have actually learned it during the most adverse circumstances to reach to each other. Materia Medica, Department of Materia Medica has earlier conducted an offline seminar, which was pretty successful and inspiration for many of the departments. That is Ignite. This is an ongoing program. On this occasion, I welcome the head of the Department of Materia Medica, Dr. Amita Balika, and while congratulating her for this initiative, and I wish her success. And it's my special privilege to welcome the main resource person of the day, Dr. Anil K., who is the Chief Medical Officer at Directorate of Homeopathy, Government of New Delhi. Now, with his vast experience and knowledge, and I'm sure that he will do justice to the topic, the Borax Pocket Manual. At present, the trend has been to work on fingertips and get to the diagnosis of the disease or remedy at the shortest possible. Definitely his experience will give a good background or support in this endeavors to start or get the knowledge of Materia Medica on the fingertips. And nothing much better than Borax Manual, which is a source of immense clinical knowledge in Materia Medica. I thank Dr. Anil for accepting our invitation. Sir, I welcome you on behalf of the college and the Department of Materia Medica to this webinar. Welcome to you, sir. I also welcome the force behind the webinar, the faculty of the Department of Materia Medica, starting with Dr. Srinath Rao, Professor, Dr. Mini Ivy, Associate Professor, Dr. Sherlin, and Dr. Arun Varghese, the Assistant Professors, who have taken keen interest and worked very hard in planning out not only this webinar, but also a set of activities to mark this initiative by the Department of Material Medica. Welcome to you, each one of you, dear colleagues. I see a number of colleagues with us, and to begin welcoming all, I welcome all of them, and also I welcome our Vice Principal, Dr. Vilma Mere de Souza. I can see her, and I also welcome the Medical Superintendent, Dr. Girish Navada, Dr. Deepa Pais, Deputy Medical Superintendent, and all the faculty members to this webinar. I welcome postgraduates and the number of undergraduate students who are sincerely attending this webinar. I hope this webinar will be a good learning session for all of you. While I thank the entire technical team headed by Dr. Vivek Shaktidharan and Dr. Sebastian, and I also thank all the support team behind this initiative or behind this our effort. Welcome to each one of you, and I wish each one of you a learning session this afternoon. All the best to you.
Thank you, sir. Now I invite Dr. Amita P. Baliga, Professor and Head of Department of Homeopathic Medica, Father Muller Homeopathic Medical College, to introduce Ignite 2022 and introduce our resource person for the day.
Very good afternoon, one and all. Learn continually. There is always one more thing to learn. A quote by Steve Jobs. Department of Materia Medica of Father Muller Homeopathic Medical College has planned various curricular activities for the year 2022 in the name of Ignite 2022, commemorating the birth and death anniversaries of stalwarts, particularly those who have contributed to the subject of Materia Medica as an innovative initiative. In this regard, already we have conducted comic strip competition and digital chart making competition on Materia Medica drugs for our undergraduate students, and they have participated with a great enthusiasm. As a head of the Department of Materia Medica, I would like to acknowledge the support of our management, especially our Administrator, Reverend Father Roshan Krasta, Assistant Administrator, Reverend Father Rohan Dias, and our Principal, Dr. E.H.A. Prabhukiran, for the encouragement and for providing us all the facilities to organize these activities. As Peter Drucker has rightly said, knowledge has to be improved, challenged, and increased constantly, or it vanishes. We, the faculty of Materia Medica Department, as a part of continued medical education, have planned to conduct a webinar titled Pocket the Borax Pocket Manual, keeping in mind the needs of students and practitioners by the eminent speaker, Dr. Anil K. As we all know, the William Boericke Pocket Manual of Homeopathic Materia Medica finds its way into almost every homeopath's library. It is a concise guide to hundreds of remedies, some of which appear nowhere else. So many homeopathic professionals are dependent on this book for daily practice. I feel Dr. Anil K. has consented to speak on this very important topic at an apt time on the eve of death anniversary of Dr. William Boericke, who died on 1st April 1929. It's a great pleasure for me to introduce our resource person today, who is going to speak on the topic upgrading knowledge of homeopathic therapeutics with reference to Dr. William Boericke's Pocket Manual of Homeopathic Materia Medica and his past clinical experiences. Dr. Anil K. is working as a Chief Medical Officer in the Directorate of Homeopathy, Government of National Capital Territory of Delhi. He completed BHMS from Government Homeopathic Medical College, Calicut in 1997. He is working in Delhi government since 2002. He has also worked as a CMO in BR Sur Homeopathic Medical College for many years. He is a renowned prescriber and has vast experience in chronic cases. His special interest being in dermatology in managing chronic cases. He has presented papers at various seminars. The recent one was at LMHI Global Colloquium 2021. Also, he has many articles to his credit. He has co-authored the book Crack the Entrance and is a regular contributor in Malayalam newspapers on health and homeopathy. He is a panelist in leading Malayalam channels on health-related topics. I am grateful to Dr. Anil K. for readily accepting our invitation to be the resource person for this webinar. I also highly appreciate all the delegates for attending in large numbers, and this certainly encourages us to carry forward with such activities in future. I wish everyone a fruitful session today. Thank you.
Thank you, ma'am. It is my privilege to propose the vote of thanks for today's short introductory program. First and foremost, I offer my gratitude to Lord Almighty for blessing us with this beautiful day for this enlightening session. Next, I thank our administrator, Reverend Father Roshan Krasta, our assistant administrator, Reverend Father Rohan Dias, for ever supporting all our departmental activities. I would like to offer thanks to our principal, Dr. E.S.J. Prabhukaran, for gracing this occasion with his presence and for guiding all our departmental endeavors. Thank you, sir. And I also thank Dr. Wilma Mira D'Souza, our vice principal, for her ever supporting encouragement. I thank Dr. Anil K., our resource person for the day, for having agreed to be the speaker for the session. Thank you, sir, and awaiting to hear from you. I would like to place on record and extend my gratitude to Dr. Vivek Shaktidharan and Dr. Sebastian, our colleagues, for guiding us step by step in the technical aspects of a web session and being ever ready to extend a helping hand. Thank you, Dr. Vivek and Dr. Sebastian. Also noteworthy is the effort put up by all our departmental postgraduates, and among them Dr. Ajay, MD Part 1 scholar, who has diligently coordinated with Dr. Vivek and Dr. Sebastian relating to technical aspects. Thank you, Dr. Ajay. I would like to thank the entire Metro Medica department, staffs and postgraduates, and our HOD, Dr. Amita P. Baliga, for being the meticulous planner backed by the contributions and suggestions from all our Metro Medica members, which has materialized into today's webinar. Thank you all. I extend my gratitude to the management, to the housekeeping and IT department for all the arrangements. Thank you. Last but not the least, all our 1,157 registered delegates online for taking out time from your busy schedule to accommodate our web session. Wishing you all an enriching session ahead. Before I hand over to our resource person, I would like to make few announcements. I request all delegates to mute their mic and to keep their videos off to avoid any distractions to the speaker. And if any queries are there, please kindly put them in the chat box, which will be answered by the speaker towards the end of the session. And also a very vital piece of information, there will be a feedback form link circulated at the end of the session in the chat box, after filling which only you will be receiving a certificate. So please stay tuned as I now hand over the session to Dr. Anil K. Over to you, sir.
Good afternoon, everybody. It is really an honor and privilege to be here as a speaker today on this auspicious occasion in this prestigious institute. I am very happy to be a part of Ignite 2022 CME program conducted by Father Muller Homeopathic Medical College, Department of Materia. Respected Principal Dr. Prabhukiran, respected Head of Department of Materia Medica, Dr. Anita Baliga, my dear friends, doctors, and students. Today I have been invited to give a lecture on Borax Materia Medica. Upgrading the knowledge of homeopathic Materia Medica based on Borax pocketbook and my past clinical experience. Let me start screen sharing. Upgrading knowledge of homeopathic therapeutics with reference to Borax Pocket Manual of Materia Medica and past clinical experience. You know, Materia Medica is an ocean. It's a big ocean, and Borax Materia Medica is a small ocean rather. So discussing the topic within one day within 2 hours is a Herculean task rather. Anyway, within the short span of time, I'm interested to discuss the points that I noticed in my clinical practice. You know, all of us read Materia Medica thousands of times. Even if you're reading after thousands of time, you may not a new point, a new symptom, or a new prescription aspect. That is the beauty of Materia Medica. So based on my clinical experience, I'm moving on to the slide. The first medicine that I'm discussing, absinthium. Absinthium is a medicine generally indicated for epileptic convulsions and in kleptomania. In kleptomania is a behavioral disorder in children. You know, there are 3 medicines in Kent's repertory for kleptomania: Artemisia vulgaris, curare, nexomica. In Kent's repertory, these are the 3 medicines with 2 marks. Another indications are chorea, tremor, vertigo with a tendency to fall backward. Another medicine with the same symptom is Reslox. General confusion, wands head low, pupils dilated, face blue, spasmodic facial twitching, dull occipital headache. Other medicines are gelsemium and picric acid. Premature menopause. This is the only medicine that I have noticed this particular symptom in Borax Materia Medica. You know, nowadays premature menopause is very common because of various reasons. So this is the one and only medicine that I have noticed. Maybe based on my experience, I am saying this is the only medicine with the particular term premature menopause in Borax Materia Medica. Next is asculus. Fullness in various parts, dry, swollen mucous membranes, lameness in neck, aching between shoulders, region of spine feels weak, back and legs give out, backache affecting sacrum and hips, worse by walking or stooping. When walking, feet turn under, soles feel sore, hands and feet swell and become red after. Much pain but little bleeding. Hemorrhoids feel full of small sticks. The other medicine that we can think is hemamelis and millifolium. In hemamelis, there will be painless bleeding. In millifolium is painless bleeding and hemamelis painful bleeding. Next is allium cepa. Allium cepa commonly be prescribed for allergic rhinitis, and it is a very useful medicine for ulcers on heel, especially shoe bite. There are 2 medicines in cancer repertory for shoe bite: extremities, ulcers, foot, shoe after. The other medicine is Borax. Borax and allium cepa, these are the 2 medicines in cancer repertory for shoe bite. Lamium, Arsenic Iodide, these are other medicines that we can be taught. Painful affections of fingers, about nails, neuralgia of stump, sneezing, especially when entering warm room, copious water and extremely acrid discharge, filling of lump at root of nose, hay fever. These are the medicines: hay fever, Sabadella, Cilicia, Sorinum, fluent coryza with headache, cough and hoarseness, and nasal polypus. Next is alumina. Point of nose cracked. The other medicine with the same symptom, especially in vestibulitis: antimonium crudum, oromate, graphitis, petroleum. Nostrils sore, worse, scab with thick yellow mucus, and skin chapped, dry, tettery, intolerable itching when getting warm in bed. It is a very good medicine for eczematous conditions, lichenified eczema. There will be intolerable itching with lichenification. It is a very common condition following eczematization. Abnormal craving for chalk, charcoal, dry food, tea grounds. Heartburn, feels constricted. Aversion to meat. Other medicines are Graphitis, Arnica, and Pulsatilla. And potato disagrees. The other medicines for disagree of potato is Thuja and Camphor. No desire to eat, can swallow, but small morsel at a time. Next is Agraphis nutans. It is indicated in catarrhal conditions, obstruction of nostrils. In adenoids, the other medicines are Calcarea iodide, Calcarea phos, Lycerium. These are the three medicines that in the term adenoids are used in Borax Materia Medica. Cystitis canadensis also is very useful in case of adenoids, throat deafness, enlarged tonsils, mucus diarrhea from cold, chill from cold wind, throat and ear troubles with tendency to free discharge from mucous membrane. We know as a complication of adenoids, generally it will lead to serous otitis media, and this is a common cause of loss of hearing or deafness in case of children. So that is why the word throat deafness is used. It's a complication of adenoids. It will affect the ear, serous otitis media develop, and because of that, the hearing capacity will be impaired. Next is ammonium carb. Stoppage at night with long continued coryza, can't breathe through mouth, snuffles of children, epistaxis after washing and after eating. Tip of nose congested, hoarseness, cough every morning about 3 o'clock. Supermet is other medicine. In 2 to 4 a.m. Kalicar. With dyspnea, palpitation, burning in chest, worse by ascending, chest feels tired, and emphysema. The other medicines in Borax Materia Medica with the condition emphysema is Antimonium arsenicum, Coca, Philandrium, Naphthalene, and Aspidosperma. An inclination to stretch limbs, constant stretching for hours. Other medicine is amyl nitrosum and Simex. Heels painful on standing. Ammonium carb is a very useful medicine for heel pain. Heel pain is a common condition nowadays. All of us know the common cause of heel pain are Achilles tendonitis, plantar fasciitis, retrocalcaneal bursitis, and injury to calcaneus bone, osteoarthritis affecting the calcaneum. These are the common cause of heel pain. And heel painful on standing, ammonium carb, on sitting, valeriana. There are many other medicines also that we'll be discussing in later slides. Tearing in ankle and bones of feet. Next is ammonium muriaticum. Pain as from ulceration in fingertips, shooting and tearing in tips of fingers and toes, ulcerative pain in heels, contraction of hamstring tendon, magnesium ore, Simex, graphitis, Simex is bedbug, abrotanum, ruta, causticum. These are the other medicine for contraction of hamstring tendons. And sciatic pain, worse by sitting, better by lying. Neuralgic pain in amputated limbs, offensive sweaty feet, pain in feet during menses, crumbling of stool. Other medicines are McMoor and Nettermore. Hard crumbly stool covered with glary mucus. These are some of the important symptoms of ammonium. And as far as ammonium is concerned, it is indicated in sciatica, left-sided sciatica. The other medicines for left-sided sciatica, Calibike, Calicarb, Thuja, Iris versicolor. In Iris versicolor, it is a very common medicine used for gastric complaints as well as headache, and in pancreatitis also. There are 3 medicines for pancreatitis in cancer repertory: Iris, Iodum, and Conium. These are the 3 medicines for pancreatitis in cancer repertory. So iris can be used in case of sciatica, left-sided sciatica, pain radiate till popliteal fossa. Other medicine is colocin. Colocin also radiation is till left-sided sciatica with pain radiating till popliteal fossa. There are two medicine. One is colocin, other is iris versicolor. And right-sided sciatica medicines are nephelium. Nephelium is a medicine for right-sided sciatica, pain radiating till the toes with numbness. And lacosis. Lacosis, even though it is a left-sided medicine, sciatica is right-sided. Phytolacca, Macphos, Tellurium. These are the other medicine for right-sided sciatica. And left-sided sciatica, already told you, ammonium, Calibite, Calicar, then Rustox. Most of the symptoms of Rustox are right-sided, except sciatica and skin complete. Erysipelas starting from left and going to right. And paralysis of Rustox also is left-sided. So Rustox, in comparison, I am saying regarding the sciatica. Next is Angostura vera. Angostura vera, there is greatest craving for coffee. It is a characteristic symptom in Angostura vera. Other medicines with the desire for coffee are Meserium and Nux moscata. Aversion for coffee, fluoric acid, sulfuric acid, and chamomilla. These are the medicines for aversion for coffee. Irresistible desire for coffee, pain in articulation of jaw, TM joint arthralgia, that is temporomandibular joint arthralgia. This is a very common condition. Other medicines are Rustox, strychnine, that I will discuss later. Pain in articulation of jaw, in masseter muscles, as if fatigued by chewing too much, cramp pain on the zygomatic arch, stiffness and tension of muscles and joints, pain in limbs, arms tired and heavy, caries of long bones, coldness of fingers, pain in knee. Angostura vera is a very useful medicine I have given in many conditions with rheumatoid arthritis as well as ankylosing spondylitis. Pain, stiffness, these are the features of ankylosing spondylitis as well as rheumatoid arthritis. Have seen in symptomatic relief. Obviously, in these conditions, we expect symptomatic relief to the patient. Angostura vera in 30 potency, in repeated dose, in few cases have given in tincture also, as in case of acute phase management. Angostura vera is very useful. Next is antimonium product. Pimples, pustules, and boils on face, yellow crusted eruptions on cheek and chin, nostrils chapped and covered with crusts, eczema of nostrils, sore, cracked, and scurfy, cracks in corners of mouth. Other medicines are aram-triphyllum, nitric acid, pondurango, graphitis. It is a depacking medicine. The duration of action is for around 40 days. Blotting after eating, constant belching, desire for acids and pickles. The other medicine for desire for acids, sour things are, there are 3 medicine in Ken's repertory with a desire for sour things. With 3 marks: Heparsulf, Corallium rubium, and Veratrum. These are the 3 medicine in Ken's repertory for desire for sour things. Blotting after eating. And next is antimonium tartaricum. Violent pain in sacrolumbar region, slightest effort to move may cause retching and cold clammy sweat, sensation of heavy weight at the coccyx, dragging downward all the time, difficult deglutition of liquids, vomiting in any position except lying on right side, nausea, retching and vomiting, especially after food, with deathly faintness and prostration, thirst for cold water, little and often, and desire for apples, fruits, and acids generally. Other medicines for desire for apple are guaiacum, sulfur, aloes. These are the medicines, other medicines in cancer repertory with the desire for apple. Nausea produces fear with pressure in precordial region, followed by headache with yawning and lacrimation. The complementary of antimony tartaricum is ipecac. Ipecac is also a very important medicine for nausea and vomiting and respiratory complaints. In antimony tartaricum, the tongue is coated. In ipecac, the tongue is clean. Next is Arania diadema. Hydrogenated constitution. Abnormal sensitiveness. It is from spider kingdom. Purple cross spider is the common name of Arania diadema. Hydrogenated constitution with abnormal sensitiveness to damp and cold, inability to live near freshwater, lakes, rivers, etc., or damp places, chilly places. Other medicines are natron sulf and thuja for hydrogenated constitution. Pain in post-calcis, sensation of swelling and parts going to sleep. Generally, as per Boericke, Arania diadema 3 to 30th potency is the potency suggested in Boericke. Argentum metallicum. Argentum metallicum is a common medicine for postnasal dripping and respiratory complaints, especially upper respiratory. Raw, hawking, gray jelly-like mucus, and throat sore and coughing. Profuse and easy morning expectoration. Easy expectoration, looking like boiled starch. Feeling of raw spots near suprasternal fossa. Worse from use of voice. Cough from laughing. Active fever at noon. When reading aloud, must hum and hack. The patient have to hum and hack to clear the throat. Other medicines are arginine nitricum, corallium rubrum, hepar sulf, calicarb, natrum carb. These are the medicines basically for postnasal dripping in cancer repertory, throat, mucus, posterior nails from ovary. These are the medicines in cancer repertory, like arginine nitricum, corallium rubrum, hepar sulf, calicarb, natrum carb. Great weakness of chest, birds on left side, alteration in timbre of voice, pain in left lower ribs. Argentum nitricum, paraplegia with myelitis and disseminated sclerosis of brain. Cannot walk with eyes closed, trembling with a general debility, paralysis with the mental and abdominal symptoms, rigidity of skulls, debility in skulls especially, walks and stands unsteadily, especially when unobserved, numbness of arms, post-diphtheric paralysis after delirium, sleepless from fancies before imagination, horrible dreams of snakes and of sexual gratification. Other medicines are lacaninum, ranunculus scleratus for dreams of snakes. And duration of action of this medicine is around 30 days. And this is very useful in gastric complaints, including belching, irritation, and this is one of the 3-mark medicine for craving for sweets. Other medicines are sulfur and lycopodium. I think these 2 are 3-mark. China also 3-mark, and calcaria is 2-mark, I think. These are the high-grade medicine for desire for sweets. Next is Arnica Montana. Crops of small boils one after another, hot with cold body, febrile symptoms closely related to typhoid, shivering over whole body, heat and redness of head with the coolness of rest of the body, internal heat, feet and hands cold, nightly sour sweats, aversion to tobacco. Other medicine for aversion to tobacco was calcaria carb, nexomica, and phosphorus. For desire for tobacco, tabacum, staphysagria, these are the other medicine for desire for tobacco. The next medicine is Arsenic Iodide. And regarding Arnica Montana, is very useful in small boils, one after another. Other medicine is Ictiolum, and another medicine is Cilicia. And Sickle core, crops of boils, small painful boils with a green content. And another medicine is tuberculum. Tuberculum, especially boils with the green content, especially in nose. In recurrent pharyngolysis of nose, tuberculum is going to be very useful. Have clinical experience in treating many such cases. Next is Arsenicum alba. Suicide complaints, Natremor and Aquamarina, great exhaustion after slightest exertion. Ill effects of vegetable diet, melons. You know, in summer season, it is very common to get complaints after watermelon. The common medicines are Arsenicum alba and gingiber. Gingiber in colic after melons. Gingiber is the medicine, is very useful, diarrhea and colic. Ill effects of vegetable diets, melons, and watery fruits generally. Watermelons including water fruits. Arsenic alba is a very common medicine. And urine, albuminous epithelial cells, cylindrical clouds of fibrin and globules of pus and blood. After urinating, feeling of weakness in abdomen, Bright's disease. Bright's disease is an older terminology for nephritis. Other medicines are terbinthina and mercur, and diabetes. Palpitation, pain, dyspnea, faintness, irritable heart in smokers and tobacco chewers. Tobacco heart, other medicine is one is phosphorus. And pulse more rapid in morning, dilatation, cyanosis, fatty degeneration, angina pectoris, pain in neck and occiput. 60 to 90 days is the duration of action of this medicine. And as all of you know, it is a very useful medicine in arsenic album in skin complaint, including psoriasis, eczema, and blackish color of the skin, even in fungal infections. In tinea cruris and tinea corporis, arsenic album is in high potencies. It's going to be very useful because you know we are entering into the summer season, and fungal infections, especially tinea cruris, is very common. And homeopathic medicines is going to be much helpful, along with the general management, proper general management. Guide the patient, advise the patient to maintain local hygiene, change the dress properly, and to keep the area dry. These are the general guidelines to be advised to the patient. Along with that, we are giving homeopathy medicines, correct medicine. This is going to be very useful. Next is arsenicum iodide. Thin, watery, irritating, excoriating discharge from anterior and posterior nares, sneezing, hay fever, irritation, tingling of nose, constant desire to sneeze, chronic nasal catarrh, swollen nose, profuse thick yellow discharge, membrane sore and excoriated, aggravation by sneezing. It is a very useful medicine in allergic rhinitis. Another medicine found to be useful in allergic rhinitis are Iodide, Trophyllum, Psoriasis. These are some of the medicine found to be much helpful, especially in the acute stages and of allergic rhinitis. This medicine is found in low potencies in repeated dose, found to be much useful. Dry, scaly itching, marked exfoliation of skin in large scales, leaving a raw exuding surface beneath, ichthyosis, enlarged superfluous glands, venereal bubo, debilitating night sweats, eczema of the bird, watery, oozing, itching, worse, washing, emaciation, psoriasis. It is one among the 4 medicines with 3 mark for psoriasis in Cancer Arsenic, Lycopodium, Phytolacca, and Sepia, ALPS. These are the 4 medicines in Cancer which are 3 mark for psoriasis. Arsenic, Phytolacca, Lycopodium, and Sepia. Psoriasis, acne, hard, indurated base with pustulate apex. So this is another one case that I treated. A case of psoriasis, I treated a few years back. So you can see the large scale, considering the symptom I gave Iodide. It's a very old patient of psoriasis, and he has taken many medicines. You can see the response within 1 week. On 5th of December, I have given Arsenic Iodide 31 dose, and I called the patient next week for follow-up. We can see the difference. There is marked difference in scaling within 1 week. And next is the patient after 1 month on January 23rd. Then see the same patient after 1 year. You know, psoriasis, the disease characterized by aggravation in winter, and 10th of January. So, no, all of you know who about the climate of Delhi is well aware that December and January are the coldest months of Delhi. And after 1 year, in the winter month of January, this is the photo. It is visible. So it is clear to what extent Iodide was effective in helping the patient to get rid of the disease. So generally prescribed in psoriasis as well as allergic rhinitis, Iodide with wonderful results. The next is Aspidosperma. Aspidosperma, otherwise called Cabraco. It is called as the digitalis of the lung. It removes temporary obstruction to the oxidation of the blood by stimulating respiratory centers, increasing oxidation and excretion of carbonic acid, pulmonary stenosis, thrombosis of pulmonary artery, uremic dyspnea. As a complication of renal failure, uremia generally leads to dyspnea. An effective remedy in many cases of asthma, it stimulates the respiratory centers and increase the oxygen in the blood. Band of breath during exertion is the guiding symptom in cardiac asthma. The other medicines for cardiac asthma, you know, this because of left ventricular failure. Adonase, Sembul, Lycopus virginicus, Aconitum ferox, Iberis. These are the medicines in Borax Materia Medica with the terminology cardiac asthma. So I have those medicines with the terminology cardiac asthma. Adonase, Sembul, Lycopus, Aconitum ferox, and Iberis. Next is belladonna. Heat, redness, throbbing and burning. This is a great children's remedy. Epileptic spasm followed by nausea and vomiting, scarlet fever, and also a prophylactic aversion to meat and milk. There is for cold water, dry and hot, swollen, sensitive, burns, scarlet, smooth, eruption like scarlatina, suddenly spreading, erythema, pustules on face, glands swollen, tender, red, boils, acne, rosacea. Belladonna is a very useful medicine for urticaria also. Urticaria aggravation in morning. There is only one medicine in cancer repertory. That is belladonna. So I have treated many cases of chronic urticaria with belladonna. Especially if you are getting that specific modality aggravation. And other medicine with which I have treated chronic urticaria. Chronic urticaria is common nowadays, as all of you know. Calcareous, sulfur, natramor, especially in LM potencies, I found good results. This is the case of chronic urticaria that I have treated with calcareous and belladonna. The patient improved much with calcareous 0/1. In acute phases, I have given belladonna 200. You know the relationship between belladonna and calcareous also we know. So this is a 23-year-old homeopathic doctor. She has a history of frequent intake of aspirin. Maybe that may be the reason she had a chronic headache and she used to take aspirin generally. And for 3-4 years, she has taken aspirin, and later on, she developed urticaria, chronic urticaria, and she has taken many medicines. As we usually say, many medicines she has tried, and later on, she came to me and I prescribed calcareous in Surabar-1 potency, and she responded well. In acute phases, on few occasions, I given belladonna, and I had treated these patients around 7-8 years back. She has no any recurrence of the same problem after the road treatment. Next is Bellis perennis. Complaints due to cold food or drink when the body is heated. This is a very common medicine that can be given in summer season. You know, in summer season, so after getting body hot, then we have a tendency to take cool drinks. So in such conditions, Bellis perennis can be given. It is the princely remedy for all laborers, especially gardeners. Varicose veins in pregnancy. During pregnancy, inability to work. Other medicines for varicose vein in pregnancy are Amamelis, Lycopodium, Pulsatilla, and Singament. Joints or muscular soreness, itching on back and flexor surface of thighs, pain down anterior of thighs, wrist feels contracted as from elastic band around joints, sprain feels contracted as from elastic band around joints, sprains with the great soreness, railway spine. This is a common medicine given in injuries generally. Benzoic acid. Urine repulsive odor, offensive smell of urine, changeable color, brown acid, enuresis, dribbling, offensive urine of old men, excess of uric acid, vesical catarrh from suppressed gonorrhea, cystitis, joints crack on motion, tearing with stitches, pain in tender Achilles. This is the italics in Boericke. Rheumatic gout, benzoic acid is indicated in gouty diathesis, knots very painful, gouty deposit, ganglion, swelling of the wrist, pain and swelling in knees, tearing pain in great toe. And pain in tender Achilles, other medicines are Calibic, Singamet, Ruta. As I already told you, Achilles tendonitis is a reason for injury. Achilles tendonitis is one of the extra-articular manifestation of ankylosing spondylitis also. Apical fibrosis, anterior uveitis, Achilles tendonitis. These are the extra-articular aortic regurgitation. These are the 4 A's. So these are the extra-articular manifestations of ankylosing spondylitis. Ankylosing spondylitis. So we get many patients in our OPD. Maybe I think in Delhi, many cases are reported of ankylosing spondylitis. Even the OPD of Homeopathic Medical College and Homeopathic Hospital, we are getting many patients. So I think there should be a thorough study why these type of conditions are increasing day by day, especially with reference to Delhi, I can say. So in connection with Achilles tendonitis, I was discussing about ankylosing spondylitis. These are the extra-articular manifestations of it. May be associated with, it is not compulsory in all cases of Achilles tendonitis, there should be ankylosing spondylitis, but it is one among the extra-articular manifestations of ankylosing spondylitis. Generally, it is given in low potencies, 3rd to 30th potency, as per Boericke. Then Berberis vulgaris. Nausea before breakfast, heartburn, hoarseness, polypus of larynx, tearing, stitches in chest and region of heart. In vocal cord polyp, there are 2 medicines in cancer repertory. One is Berberis vulgaris, other one is Tuja. I have treated 3 cases of vocal cord polyp with Berberis vulgaris. One patient, I remember I treated 3-4 years back. And she was a 45-year-old lady. She was a music teacher. And as usual, it is common in speakers, professional speakers, teachers, singers, etc. It is also called singers pedue, as all of us know. And she was diagnosed with the vocal cord polyp, and she was scheduled surgery. And in between, she came to me, and the surgery was posted after 1 month. So I started with the medications. Berberis vulgaris 30 in frequent repetition I have given for 5 days. And after that, I gave a gap of 2 weeks and repeated again after 2 weeks. After 1 month, patient came back to me. She went to the ENT surgeon for the surgery, and along with the pre-anesthetic checkup, PAC, the surgeon examined, and he found there is no need of surgery because the polyp have disappeared. So I have treated 2 more cases also. In such another cases also, the patient responded symptomatically. In the 2 patients, there was no repeat ENT examination was not done. But as the patient was symptomatically improved, there was no need of surgery in other 2 cases also. In the first case that I have told about a lady around 40 plus, in repeat ENT examination, the doctor suggested there is no need of surgery, polypectomy, as the polyp has regressed. And next is flat wart, itching, burning and smarting. Worse by scratching, better by cold applications, small pustules over whole body, eczema of anus and hands. So it is a very effective medicine for eczema around anus. And circumscribed pigmentation following eczematous inflammation. That is post-inflammatory hyperpigmentation. There are many causes of hyperpigmentation, and one among that is post-inflammation. After inflammatory reaction, it is very common after acne and many other conditions, there will be hypermelanosis, hyperpigmentation. So Berberis vulgaris in low potency in frequent dose. Obviously, as far as hypermelanosis is concerned, the treatment is a very long treatment, because in any pigmentation disorders, whether it is hyperpigmentation or depigmentation, because for the production of pigments, so there is a long duration is required. So as far as the treatment of pigmentation disorder is concerned, it is a long-term treatment. So I have treated few cases of post-inflammatory hyperpigmentation with Varicose vulgaris, and the result was excellent. Then is rheumatic paralytic pain in shoulders, arms, hands and fingers, legs and feet, neuralgia under fingernails, swelling of finger joints, sensation of cold on outside of thighs, stitching between metatarsal bones as from a nail when standing, pain in balls of feet on stepping, intense weariness and lameness of legs after walking short distance. So Varicose vulgaris is medicine for gout, and it is very useful in foot pain, stitching between metatarsal bones. Other medicine is Sabina, is also very effective in case of foot pain, especially pain between metatarsal bones. And nausea before breakfast, another medicine is Sepia. Then Borax. Red nose of young women, red and shining, swelling with a throbbing and intensive sensation, tips swollen and ulcerated, dry crust. Borax is very useful in nasal vestibulitis and nasal pharyngolysis. Nasal vestibulitis, that is the inflammation of nose infection. Nasal pharyngolysis or nasal vestibulitis is a very common condition, and with the crust formation. And I have treated many cases, as far as nasal vestibulitis or nasal pharyngolysis is concerned. So treatment is a bit risky because the nose is associated with the dangerous area of the face. So there is a chance of spreading infection to the brain. So definitely while treating, the patient should be basically the patient advised to avoid repeated nose picking and all. So we should be very cautious while treating such patient, but the result with the Borax is very good. Then psoriasis, erysipelas in face, itching on back of finger joints, unhealthy skin, slight injuries, separates, herpes, erysipelatous inflammation, the swelling and tension, chilblains relieved in open air, trade eruptions on fingers and hands, itching and stinging, ends of hair become tangled. And Pleca polonica, other medicines are Vinca minor, ends of hair become tangled. Sorinum, Vinca minor, Lycopodium, these are the other medicines. And Borax is a medicine for boils. I think it is tumor and cancer, chest eruption boils in axilla. For boils in axilla, as well as hidradenitis suppurativa. Hidradenitis suppurativa is a common condition that affects axilla, So hidradenitis suppurativa, I have treated few cases with Borax. Then next is Boericke. Scarf and crust about nostrils and corners of mouth, lips chapped, bleeding of nose and gums, cheek and lips feel swollen, acne worse in summer, italics in Boericke due to use of cosmetics. Blunt instruments leave deep impression on the skin, urticaria on excitement with the rheumatic lameness, palpitation, diarrhea, itching on getting warm, eczema, moist, formation of thick crust, pimples over the entire body, scurvy, herpetic eruptions, pruritus ani, Urticaria on waking in the morning. I told you earlier about belladonna. Belladonna is in cancer, but only one medicine is there, urticaria in the morning. In Boericke, urticaria on waking in the morning. Worse from bathing, then pellagra. Worse from bathing, urticaria aggravation after bathing. Artica urens and phosphorus, these are the medicines given in cancer. The two medicines given in cancer. Then acne in adolescence, Asteria rubens. No. In adolescent age group, acne is very common because of the hormonal changes, as all of us know. In Boericke, one medicine is there, and acne in adolescents, Asteria rubens. Next is before Rana, Venaricium, pains, pain burns upon, pets of skin, fistule, separation from every slight injury, pemphigus. Other medicines are pemphigus in Boericke. The term pemphigus is used in Caltha palestris, Carbonium oxygenatum, Delcamera, and Ranunculus. Bullae, which open and leave a raw surface, exuding in nitreous fluid, blisters on palms and soles, itching and burning, carbuncle. The whole is very useful in skin conditions, including bullous impetigo, epidermolysis bullosa, and warts in earlobe. Only one medicine is there in cancer, but that is Buforana. I have treated 1 or 2 cases with Bufo. Ear bar in earlobe. Only one medicine is there in cancer, that is Buforana. Next is Calcaria car. This is a great Hahnemann antipsoric. It's a constitutional remedy par excellence. Jaded state, that is confused state, mental or physical, due to overwork, abscess in deep muscles, polypi and exostosis, pituitary and thyroid dysfunction. I have treated many cases of hypothyroidism with antipsoric medicines, including Calcaria carb, sulfur, and Netramo. I followed around 30 cases within a span of last 3-4 years of hypothyroidism, and maximum cases I treated the sulfur, then Netramo, phosphorus, sulfur, Calcaria, Netramo, phosphorus. These are the main medicines in which I was able to reach hypothyroidism. Even TSH level above 100 also I have treated. The patient responded in hypotency. I have seen that in tandem potency works very well in hypothyroidism. Even cases at the level of TSH at the level of 50, when 100 plus also have treated, and with response within 2 to 3 months. So in most of the cases that I have treated, the thyroid level has become normal within 3 to 4 months. Raised blood coagulability is a definite stimulant to the periosteum. It's a hemostatic and give this power probably to the gelatin injections. Aversion to meat, boiled things, craving for indigestible things. All pencils also for X. Salt and seeds. See, Calcaria carb, I think it is 3 mark for both this. Either it is 3 mark or 2 mark for both salt and seed design. So generally there are alternating with other medicine. Alternating also is 3 mark for both the desire for salt as well as seeds. Milk disagrees. Frequent sour erections, sour vomiting, dislike of fat, loss of appetite when our children's diarrhea, constipation, stool first hard, then pasty, then liquid. So other medicines with the same symptom is stool first hard, then pasty and liquid. Other medicines are Bovista, Lycopodium. These are the 3 medicines In cancer pulmonary thing, all these three medicines are 3 mark. Bovsta, calcare carb, and lycopodium. Stool hard first, then fluid. Stool hard first, then soft, ethusa, alumina, carbolic acid, and causticum. So generally in cases of piles as well as anal fissure, if you are prescribing based on this symptom, this particular symptom, I found the results are good. Calcarea flu, Great Depression, groundless fear of financial ruin. Chaps and cracks, fissure or cracks in palms of the hands or hard skin, fissure of anus, separation with the callous hard edges, chief remedy for vascular tumors with the dilated blood vessels and for varicose or enlarged veins. Calcarea force, crying for bacon, ham. This is the meat of pig basically, ham and bacon. Crying for ham fat is meserium, salted or smoked meats, much flatulence. Diarrhea from juicy fruits or cider during dentition, green slimy hot, sputtering with undigested with fetid flatus. Fistula in nano, alternating to chest complaints. Silesia, Barbarous vulgaris are the other 2 medicines. There are 3 medicines. Calcarea force, Silesia, and Barbarous vulgaris. Fistula in nano, alternating to chest complaints. Involuntary sighing, chest sore, suffocating cough, better by lying down. Hoarseness, pain through lower left lung. Next is cannabis indica. Feels as if top of head were opening and shutting and as if calvarium were being lifted. Semicifuga, populus, cannabis sativa, other medicines. Urine loaded with slimy mucus must drain. Dribbling has to wait some time before urine flows. Stitches and burning in urethra, dull pain region of right kidney after sexual intercourse, backache, oozing of white glaring mucus from glands, psoriasis, prolonged thrill, sensation of swelling perineum or near anus as if sitting on a board. Chimaphila. Chimaphila is a very important medicine for BHP, and humid asthma. Cantharis, burning in mouth, pharynx and throat, vesicles in mouth, great difficulty in swallowing liquids, very tenacious mucus, violent spasms produced by touching larynx, inflammation of throat, feels on fire, constriction after ulceration, scalding feeling, burned after taking too hot food. Dermatitis vernita with blood formation, secondary eczema about scrotum and genitals following excessive perspiration, and scrotal eczema, and eczema affecting or secondary infections after fungal infections, as well as in fungal infections also. Cantharis is very effective. Cantharis is an important medicine in burns, all of you know. Tendency to gangrene, eruption with the Milli scales, vesicular eruptions with burning and itching, sunburn. Sunburn is very common in this season, and it is very effective. Sunburn, Cantharis. Burns, scalds with rawness and smarting, relieved by cold application, followed by undue inflammation. Erysipelas, vesicular type with great restlessness, burning in soles of feet and night. I am repeating in many of the symptoms is italics in cancer, Pancreatitis, burning in mouth, pharynx and throat. So it will be clear from the slide because I have the way I am presenting is focusing on the symptoms, important symptoms, and symptoms that is in italics in cancer. Difficulty in swallowing liquids. Other medicines are bell, echinacea, lacasis, and swallowing for solids, Varicose, baptisia, and calicar. Carbolic acid. Increased olfactory sensibility. Nose is very sensitive. Smell is very acute. So generally, it can be used in case of allergic rhinitis. All the patients say when the least smell affect them, they can tolerate the smell of deodorants and all. So putrid discharge, the xena with the fever and ulceration, smell very acute, itching vesicles with burning pain, burns tend to ulcerate. In cancer patry, there is one medicine or extremities ulcer ankle, that is carbolic acid, and varicose ulcers and other type of ulcers, especially in ankle, carbolic. I have treated few cases. Ulcer ankle chronic extremities chapter in cancer patry. Carbolic acid is given and it's a very useful medicine. Next is carbonium sulfate. Impotence, sciatica come within the therapeutic sphere of this remedy, useful to restrain the growth of cancer, pharyngolysis, chronic skin disease with much itchy. It is a 3-mark medicine for palmadowns in cancer patry. Graphitis, selenium, and sulfur are other medicines. I have treated few cases with carbonium sulfate, especially palmadowns with severe itchy. So here it is mentioned, chronic skin diseases with much itchy. Causticum. Weakness progress until we have gradually appearing paralysis, local paralysis of vocal cords, muscles of deglutition, of tongue, eyelid, face, Belcamera, ammonium phosphoricum, and other medicine. Gallbladder and extremities of children are slow to walk. The skin of causticum person is of dirty white sallow with the warts, especially on the face. Paralysis, right-sided paralysis. Contracted tendons, restless legs at night, right-sided paralysis. Left-sided paralysis we discussed, Arnica, Borax, these are other medicines. Chelidonium, pains in arms, shoulders, and hands, tips of fingers, icy coldness of tips of fingers. This sore, tearing in metacarpal bones, all flesh sore to touch, rheumatic pain in hips and thighs, intolerable pain in the heels as if pinched by too narrow shoe. Worse, right side, feet paralyzed, paralysis the lower limb with rigidity of the muscle. Pain under inner and lower scapula of lower angle of right scapula. Other medicines are Calicarbent, Maxol. For left side is Chenopody glossy. And chelidonium is usually given in gallbladder stone as well as in jaundice. These are for hot drinks. These are the commonly remembered, commonly studied indications of chelidonium, but have found very effective in case of knee joint pain. Extremities, pain, knee, burning type of pain in knee. Only one medicine is there in cancer patry, 3-mark, that is chelidonium. Chelidonium is found to be effective, especially right-sided knee pain in lower potencies in repeated dose. Cicuta virosa, head turned or twisted to one side, cerebrospinal meningitis, cervical muscles contracted, testules which run together forming thick yellow scabs on face and head, corners of mouth and chin with burning pain, red face, eczema, no itching. Exudation forms into hard lemon-colored crust. Cicuta is usually given according to Boericke from 6 to 200 potency. It is face eruption pustule. Cicuta is an important medicine. You can see few cases. One case of acne I have treated with this medicine. This is the photo before and after treatment. You can see the change from the photograph. The patient was treated with Cicuta and followed by SL and general management obviously have to see the other side. So this is a case of acne conglobata. That is a form of severe acne with the abscess and pustule formation. Conglobate acne or acne conglobata. The severe form of acne. And the picture speaks a lot about the efficacy of the medicine. This is another patient. A case of the same condition, acne, severe acne, that I have treated with the same medicine, Cicuta virosa. You can see both sides of the patient before and after treatment. Within 1 month, the change that happened with the medicine is clear from here. The next is simissifuga. Spine is very sensitive, especially upper part. Stiffness and contraction in neck and back, intercostal rheumatism, rheumatic pain in muscles, intercostal rheumatism, rheumatic pain in muscles of back and neck, pain in lumbar and sacral region, down thighs and through hips, uneasy, restless feeling in limbs, aching in limbs and muscular soreness, rheumatism affecting the belly of muscles, especially large muscles, horrific movements accompanied by rheumatism, jerking of limbs, stiffness in tendo Achilles, heaviness in lower extremities, heavy aching, tensive pain. So chorea, involuntary movements, non-repetitive movements with a lesion the caudate nucleus. There are two types of chorea, chorea major and chorea minor. This is the old terminology. Chorea major is Huntington's chorea, chorea minor is Sydenham's chorea. Other medicines in Boericke for chorea is Miguel, Tarantula hispanica, Tarantula and Agaricus. Cystus canadensis. I've already told you about cystus canadensis while discussing graphis mutans in case of adenoids, malignant disease of glands of neck, cystus affinity for nasopharynx, about spores that center in posterior nose, itching all over, small painful pimples, lupus, glands inflamed and indurated, mercuriocephalic ulcer, skin of hands, hard, thick, dry, fissured, deep cracks, itching of swollen hands and arms, general itching which presents during sleep, hemicrania. In canceropathy, this is a very important medicine for cracks on hands, extremities cracked. In palms, medicines are mercurocyanide, iodine, and petroleum. For fingertip, Oramet, petroleum, silicia, and eruption on fingertip medicines are Cistus natroncar. This is a case of psoriasis. It has been diagnosed by a dermatologist and he was on medication. As there was no proper response, he came to me. You can see that I treated the patient with the cracks, deep cracks, with a cyst scan, and the patient responded well. The patient is, I treated this patient 3 years back. The patient is still fine. He's a regular visitor in our OPD with his family for other complaints, etc. But there is no recurrence of this psoriasis problem after the treatment. I treated it 3 years back. That also in low potency, I given sister scan. Other medicines I've told you for cracks on palms and as well as cracks on fingertips. There's an eruption on fingertips. The next is clematis recta. Tingling urethra, lasting some time after urinating. Frequent scanty urination, burning at orifice, interrupted flow, urethra feels constricted, urine emitted drop by drop, unable to pass all the urine, pain worse at night, pain along the spermatic cord, commencing strictures. Urethral stricture is a very effective medicine, urethral stricture. I have treated symptomatically, I was able to give to the patient because there will be frequency of urination, especially at night. There are many patients, they can't sleep after all because they have to pass around 6 to 8 times or 5 to 6 times urine at night. Then you can guess how they will be able to sleep. And the other medicines for stricture urethra and cancerpatry urethra stricture, cantharis, nitric acid, petroleum, and pulsatilla, and have got good result with clematis recta. Testicles indurated with a bruised feeling. Swelling was scrotum in right side only. Bronchitis, especially affecting the right side. Other medicines are arsenine nitricum. The left side, rhododendron and pulsatilla are the medicines for left side. Conium maculatum. It is valuable remedy in diarrhea, summer complaint, and skin infections. Feels hidebound, intense itching but scratching is painful. Pustular eruptions, especially on face and genitals, with a fearful itching followed by painful burning. Vesicles, confluent, oozing, pustular erysipelas, itching exceedingly, herpes zoster, stinging, smarting, pains at eruption. And cotton digilum is generally a medicine for eczema, especially in genitals also. Cotton digilum. Next is relapse foralinus, right-sided paralysis, fear of rain, chronic nasal catarrh with fetid odor and greenish crust, azina, yellowish green discharge, mucous membrane wrinkled, nostrils plugged up with dry mucus, fear of rain. Other medicine is nausea. And right-sided paralysis, causticum, opium, and hemiplegia with aphasia, Borax, and chenopodium. These are other medicines, hemiplegia with aphasia. The next is Eugenia jambos, rose apple, acne, simple and indurated. The pimples are painful for some distance around. Palm downs, acne rosacea, nightly cramp in soles of feet, skin cracks about toes, fissure between toes, skin recedes on the nails, acne rosacea. There's an important medicine for acne during menses, especially in forehead. Dulcamara and graphitis is other medicine for acne during menses. I have treated a case, you can see from the photographs the way the patient responded. This was a very old case. The patient was having for, I think, more than 6 months history, the patient was saying, and I treated the case with the Eugenia jambos. Then Euphrasia, whooping cough only in daytime, bromium and cupramate are other medicines. The profuse lacrimation, menses painful, flow lasts only 1 hour or 1 day. Other medicine is sorinamic and staphylococcus. Late scanty sharp, amenorrhea with ophthalmia, menses painful, okay. Repetition. Next is pharynphos. First stage of otitis, membranous tympani red and bulging, acute otitis when belladonna fails and prevents separation. It's very useful in otitis externa and other inflammatory conditions also. First stage of inflammatory affections, congestion of lungs, hematitis, short, painful, tickling cough, croup, hard, dry cough with sore chest, expectoration of pure blood and pneumonia, cough better at night. And ferrum metallicum, voracious appetite or absolute loss of appetite, loathing of sour things, attempt to eat, bring diarrhea, spits of food by mouthful, italics. Irritations of food after eating without nausea. Nausea and vomiting after eating, vomiting immediately after eating. The patients, it is mentioned in the Materia Medica, from the dining table, he will go to the wash basin for vomiting. Vomiting after midnight, intolerance of eggs. Other medicines are calisulf, nitric acid, chinnamals. Distension, pressure in the stomach after eating, flatulent dyspepsia, and it is a medicine for aversion to sour things. Rheumatism of the shoulder, right shoulder, ferrometin sanguinaria. Other medicines are strontium garb, meccar. Very useful that I will discuss later on. Strontium garb and meccar. Fluoric acid, alopecia, chronic nasal catarrh with ulceration of septum, nose obstructed and dull, heavy pain forehead, dental fistula with persistent bloody salty discharge, syphilitic ulceration of throat, which is very sensitive to cold. Teeth feel warm, affects teeth and bones of upper jaw. Heaviness and weight in stomach, eat in summer before meals, eat in stomach before meals, sour irritations, aversion to coffee, wants fancy dishes, stomach symptoms are relieved by tight clothes, desire for highly seasoned food. China, phosphorus, and sulfur. These are the other three medicines in cancer patri with 3 mark for highly seasoned food. Craves cold water, hungry, warm drinks produce diarrhea, carries a necrosis of especially long bones, extremities, carries fibula, I think. Only one medicine is there, that is fluoric acid. Fluoric acid and silicea is the other 2 medicines for carries of long bones in cancer patri. In fibula, I think only one medicine is that is fluoric acid. The next is gelsemium, loss of power of muscular control, cramp in muscles of forearm, professional neurosis, writer's cramp. Other medicines are arginum metallicum, magnesia phos, brachyglottis, uric acid, stannum, sulfuric acid. Excessive trembling and weakness of all limbs, hysteric convulsions, fatigue after slight exercise, heaviness of head, bad feeling around and occipital headache, dull heavy. For occipital headache, anosmodium is also a very good medicine. Anosmodium, occipital headache with left side headache, and occipitofrontal headache with nausea and vomiting. In case of migrainous conditions, it is found to be effective in acute phase. Pain, temple extending to ear and wing of nose, headache with muscular soreness of neck and shoulder, headache preceded by blindness. Other medicines are Calibike, Grandilia, an efficacious remedy for wheezing and oppression in bronchitic patients. The sibilant rails are disseminated with foamy mucus, very difficult to detach. Acts on pulmonary circulation, asthma with profuse tenacious expectoration which relieves, stops breathing and falling asleep, wakes with a start and gasp or breath. Another medicine is lacosis, can't breathe when lying down. Grandilia in low potencies, especially in tincture forms, is very effective in case of cough as well as asthmatic attacks. Graphite is aversion to meat, sweets nauseates. Other medicine for aversion to sweets are aversion for sweets and salt. 3 mark is graphitis, and aversion for sweets. Other medicines are causticum and phosphorus in cancer patri. Radium bromide also is there. Hot drinks disagree. Nausea and vomiting after each meal. Morning sickness. Burning in stomach causing hunger. Constrictive pain in stomach. Recurrent gastralgia, flatulence. Stomach pain relieved by eating. Hot drinks, especially milk and lying down. Rough, hard, persistent dryness of portions of skin unaffected by eczema. Early stage of keloid and fibroma. Eruptions hissing out sticky exudation. Rawness in bends of limbs, groins. Unhealthy skin, very little injury separates. Ulcers discharging glutinous fluid and thin and sticky. Swelling of feet, vents. Vents is sebaceous cyst, older terminology. Next is guaiacum. Guaiacum, rheumatic sore throat with throat muscles. Very effective medicine in throat pain. Throat dry, burns, swollen, stitches towards ear, acute tonsillitis. In tonsillitis and pharyngitis, guaiacum in low potency is very useful. December apple and other fruits, aversion to milk, burning in stomach, constricted epigastric region, aching in nape, stiff neck and sore shoulders, stitches between scapula to occiput. Contractive pain between scapulae. So guaiacum is very effective in small joint pains as well as for tonsillitis. Next is hepar sulfur, hay fever. Long for acids, I told you about other medicines like hepar, parallelogram, as well as paracetamol prima. Wine and strong tasting food. Aversion to fatty food. Frequent irritation without taste or smell. Distension of stomach, compelling one to loosen the clothing. Burning in stomach. Abscess. Separating glands are very sensitive. Papules prone to separate and extend. Acne in youth. Anginoretic edema. Unhealthy skin, very little injury separates. Chapped skin with the deep cracks on hands and feet. Ulcers with bloody separation. Smelling like old cheese. Can't bear to be uncovered, wants to be wrapped up warmly. Sticking or pricking in afflicted parts. Chronic and recurring urticaria. Herpes circinatus. Constant offensive exhalation from the body. Next is hydrastis. Thick tenacious secretion from posterior nails. I told you about posterior postnasal dripping. Follicular pharyngitis. Rose, smarting, excoriating sensation. Hawking of yellow tenacious mucus. Child is aroused suddenly from sleep by this tenacious postnasal dropping. Postnasal dropping affect the sleep of the patient. As you know, hydrastis, very thick discharge. Goiter of puberty in pregnancy. Hydrocotyle. Dry eruptions, great thickening of epidermoid layer and exfoliation of scales. Psoriasis. Pustules on chest. Circular spots with the scaly edges. Intolerable itching, especially on soles. In palmoplantar psoriasis, as well as eczema, hydrocotyle is found to be very effective. Next is hypericum. Neuritis, tingling, burning and numbness, pain in nape of neck, pressure over sacrum, spinal concussion, coccygeal injury from fall with pain radiating up spine and down limbs, jerking and twitching of muscles, darting pain in shoulders, crawling in hand and feet, lancinating pain in upper and lower limb, neuritis. And it is very effective in neuritis. I have treated many cases with numbness, the features of neuritis in hands as well as upper limb as well as lower limb with lower potency of hypericum, as well as back pain also. Hypericum is going to be very useful. Sciatic type of pain. And hypericum have prescribed in many cases of styes also. Styes lower lid, hypericum is tumor. and styes on left eye. Also, hypericum is tumor. Generally prescribed medicine like staphysagria, and I've treated many cases of hypericum. That is based on cancerapathy, eye styes, lower eyelids. Hypericum is a very important medicine and it is found to be helping much. Echinacea, dry spasmodic cough. One more thing, hypericum. Echinacea, dry spasmodic cough in acute successive shocks, spasm of glottis, reflux coughs. Coughing increases the desire to cough. Some of the patients come and say, once I cough, I keep on coughing. So based on the symptom, I have prescribed in few cases echinacea and found to be helping a lot. Much sighing follows spasmodic cough, worse in evening, little expectoration, leaving pain in trachea. Iodine, sneezing, sudden violent influenza. Dry coryza becomes fluent in open air, also a fluent hot coryza with general heat of skin, pain at root of nose and frontal sinus, nose stopped up, tendency to ulceration, loss of smell, acute nasal engorgement associated with high blood pressure. Constipation with ineffectual urging, constipation better by drinking cold milk. Constipation alternating with the diarrhea. So 3 to 30 is the potency generally advised in Boericke. Juglans regia, comedons and acne on the face, crustallactia. Crustallactia is cradle cap or milk crust is usually seen in infants. Psoriasis, capitis affecting the children is crustallactia. Itching in the eruptions of small red pustules, scalp red and itches violently at night. Calibichromicum, catarrh, pharynx, larynx, bronchi, and nose, and tough, stringy viscid secretion is produced, which can uvulized, relax, edematous bladder-like uvula, pseudomembranous deposit on tonsils and soft palate, cutting through loins, pain in coccyx. Is a very effective medicine. Generally, we think of medicines like hypericum, but have prescribed in many cases. I think this 3 mark also Calibicum in cancerapathy and coccygeal pain. Pain fly rapidly from one place to another. Wandering pains along the bones, was called left-sided sciatica. I have already told you about other medicines, including Calicarb, ammonium ore, Prostox, Tolosynth. Bones feel sore and bruised, very weak, tearing pain in tibia, syphilitic rheumatism, pain, swelling and stiffness and crackling of joints. Soreness of heels when walking, tendo Achilles swollen and painful. I have already told you about tendo Achilles pain. Pain in small spots. Calicar, sweat, weakness and backache. These are the 3 important symptoms of Calicar. One of the best remedy for following labor, miscarriage, for consequent debilitated states, early morning aggravation, 2 to 4 AM aggravation, dry, parched, rough, sticking pain, as if from a fish bone, swallowing difficult, food goes down slowly, mucus accumulation in the morning, postnasal dropping. Spigella is another medicine for postnasal dropping. Large, difficult stool with stitching pain. Hours before, hemorrhoids, large, swollen and painful, itching, ulcerated, pimples around anus, large discharge of blood with natural stool, pain, hemorrhoids when coughing, burning in rectum, easy prolapses. Rectum, constipation before and during menses. There are 2 medicines, Calicarb and Silicea. 3 marks in cancerapathy. Constipation before and during menses. Silicea is there in keynote also. Constipation before and during menses. And in cases of anal fissure as well as hemorrhoids, institution based on this particular symptom is going to be helping very much. Diarrhea before and during menses, phosphorus, bovista, paracetamol are the medicine for diarrhea before and during menses. Calicarb is a very effective medicine in case of respiratory complaints as well as gastric complaints. And as I already told you, in case of anal fissure as well as hemorrhoids. Small of back feels weak, stiffness and paralytic feelings in back, burning in spine. Severe backache during pregnancy and after miscarriage, hip disease, and this is very effective medicine in hip pain also. Pain in nates, I think this left-sided hip pain. Lumbago with sudden sharp pain extending up and down, back and to thighs, pain from hip to knee, pain in knees. Kali cyanatum, cancer of tongue. These are the medicine for cancer of tongue in cancerpatry, in Borax Materia Medica, Fuligo, Gallium, and Semperviv. Agonizing neuralgia have been benefited by this drug, sick headache, sciatic pain, ulcer of tongue with indurated edges, speech difficult. Kalimu, white or gray coating of the base of tongue and expectoration of thick white phlegm seem to be a special guiding syndrome. Bursitis prepatellaris, otherwise housemaid's knee, prepatellar bursitis. And infrapatellar bursitis is clergyman's knee. The medicines for prepatellar bursitis are Sticta, Paliadad, Prostox, and slag. Slag is aluminum silicate. These are the other medicine in Boericke for prepatellar bursitis or housemaid's knee. In all these medicine, I think this mentioned in Sticta, housemaid's knee, in bracket, Paliadad, Prostox, and slag are given. Chronic ataural conditions of the middle ear, fatty or rich food cause indigestion like Persatilla, rheumatic fever, exudation, swelling around the joints, rheumatic pain felt only during motion or in this weight, nightly rheumatic pains worse from warmth of bed, lighting like small is lumbar area, which is the older terminology, lower back, this smaller back. Kali nitricum. Kali nitricum sneezing, swollen feeling, worse right nostril, polypus. Actually, in cancerpathy, only one medicine is there, polyp on right nostril, that is Kali nitricum. There are many other medicines for polyp like lemnamyra, sanguinaria, calcarea carb, but for polyp in right nostril, only one medicine is there, is Kali nitricum. And stitches between shoulder blades, tearing and sticking in shoulders and joints, hands and fingers swollen. Kali nitricum is a very effective medicine for shoulder pain also. Shoulder pain especially aggravated at night. Periarthritis, we are getting nowadays many cases of shoulder pain aggravated at night. Cancerpathy, two medicines are there, two mark, Kali nitricum and Kali bichromicum. And Kali nitricum, desire for spicy things are marked in Kali nitricum. Next is Kalmia, pain from neck down arm in upper three dorsal vertebrae, extending the shoulder blade, pain, descending pain basically, pain down back as if it will break, in localized regions of spine through shoulders, lumbar pains of nervous origin. Kalmia is very effective in cervical spondylotic pain as well as back pain. Lacanine, sensation of walking or floating in the air, pain first on one side, then the other side, blurred vision, nausea and vomiting at the height of attack of a day, occipital pain with a shooting extending to forehead, sensation as if brain were alternately contracted and relaxed, noise in the ears, right side of sciatica, leg feels numb, then stiff, cramps in feet, rheumatic pains in extremities and back. And Next is lac defloratum. Despondent pain begins in forehead occiput in morning and rising. Intense throbbing with nausea, vomiting, blindness, and obstinate constipation. Worse, noise, light motion during menses with great prostration. It is a very effective medicine, lac canina, and stool, constipation, stool, hard, large, with great straining, painful, lacerating anus. And differentiation between lac canina and lac defloratum is lac caninum desire for milk is there, in lac defloratum aversion to milk. And in lac defloratum, constipation is marked, stool hard and large. And in lac caninum, desire for milk and spicy cheese. And spicy things, especially pepper, mustard, salt, etc. Lac defloratum desire is much marked. So this is the way we can differentiate between lac caninum and lac defloratum. Headache begins with dim vision in iris vesicular also. And headache preceded by dim vision, I have told you Calibike and Gelsemium as the medicine. Headache preceded by dim vision. Once headache start, vision become normal in Calibike as well as Gelsemium. Headache begins with dim vision, iris vesicular, and lac defloratum. Next is lactasis. Craving for alcohol, oysters, any food causes distress. Pit of stomach painful to touch, hungry, can't wait for food. Annoying pressure made better by eating. So I will make it fast because our time is going to end. Hardly 40 minutes are left. So I will be going a bit fast. Right side of sciatic, I already told you, lactasis. Upper part of windpipe is very susceptible to touch, and breathing almost stops on falling asleep. Already told about grandilia. Little secretion and much sensitiveness. Burst pressure on larynx. Cough, dry, suffocative. Lycopodium, hives, bursts from warmth, violent itching, fissured eruptions, acne, chronic eczema associated with the urinary and gastric complaints, offensive secretions, vicious and offensive, and psoriasis. I told you, psoriasis 3-mark medicine, arsenic, lycopodium, phytolacca, and sepia. These are the 3-mark medicine. This is the case of plantar psoriasis. I have treated with lycopodium. And extremities, cracks, heals. Only one medicine is there in cancer patri, that is lycopodium. You can see in this patient, cracking is marked in the heel of the patient. Extremities, cracks. And basically, the prescription was based on constitutional symptoms of the patient, and you can see the difference. So this is a very old patient. She has a history of 6 to 7 years of history of the problem, and the photo shows the improvement. And then magnesia carb, desire for fruits, acids, and vegetables, irritations, sour and vomiting of bitter water, craving for meat. Faramet is another medicine for craving for meat. Green, watery, frothy like frog pond scum. This is very useful in diarrhea, especially of children. Greenish diarrhea, offensiveness, diarrhea during dentition. Very effective. Milk passes and dies. I have treated many patients of magnesium carbon low potencies. Tearing pain in one side, worse part must move about. Then ailments from cutting wisdom teeth. Macar, calcareous floor, and silicea are the other medicines. In cancer patty, teeth, wisdom, ailment from. Tearing shoulder as if dislocated, right shoulder painful, can't raise it. I told you magnesia carbon strontium carb along with the Faramet and sanguinaria for right-sided shoulder pain. Macar and strontium carb both are very useful in case of pain in shoulder, especially right shoulder. Then magnesia force, involuntary shaking of hands, paralysis agitants. Other medicines, Maxol, Gelsemium, or other medicines for paralysis agitants. The Manganum aceticum, Coria, Absinthium, Agaricus, Simicifuga, Miguel, Sulfuric acid, Tarantula, Writers and Place cramp, tetanic spasms, weakness in arms and hands. Then magnesia sulf, small pimples all over the body that it's violently suppressed itch, crawling in the tips of fingers of the left hand, extremities, eruption, itching, upper arm. Only one medicine is there, that is magnesia sulf. So I have treated a few cases, upper arm eruptions with itching. So it's a magnesia sulf in low potencies is found to be, you can see the cancerapathy, extremities, eruption, upper limb, upper arm itching, magnesia sulf. Only one medicine is there. Then next, Meganum aceticum, chronic hoarseness, larynx dry, rough, constricted, tuberculosis of larynx, cough better by lying down. Euphrasia and parameter, other medicines, cough better by lying down. Muscular twitching, cramps in palms. Every part of the body feels sore when touched, can't walk backwards, tending to fall forward, walk stopping forward. Paralysis agitants, that is Parkinsonism. The older terminology of Parkinsonism is paralysis agitants. Magnesia force, Maxol, Aurum sulf are other medicines. There are plenty of medicine in cancerapathy like Agaricus, Rustock, Sigamet, Calibro. I am telling about the medicines in Boericke where paralysis agitant is the term is used. Macforce, Maxol, Aurum sulf, Manganum aceticum. Peculiar slapping gait, wax on metacarpophalangeal joints. Next is Mancinella. Skin centers most marked dermatitis with excessive vesiculation, oozing of sticky serum and formation of crust, intense erythema, vesicles, fungoid growth, erysipelas, large blisters as from scalds, heavy brown crust and scabs, symphagus. I've told you already about the medicines like Alta palstris, Mancinella, Bufurana, Carbonium oxygenatum. Then Mercurius. Much sneezing and sunshine. Nostrils raw and ulcerated, nasal bone swollen, yellow green, and pain in nose, inflammation of nose. Arnica metallicum or metallicum is a very useful medicine. Nose inflammation, nose pain, especially in chronic rhinitis, dryness of nose in these symptoms. In this connection, I am telling argentum or metallicum is very useful. Pain and swelling of nasal bones and caries with greenish fetid ulceration, nosebleed at night, sneezing, worse in damp weather, profuse fluid, tremors, paralysis agitants, intense thirst for cold drinks with continuous hunger. Next is Mercor. Tenesmus often involves the bladder as vessel. Bright disease, I already told you about other medicine like Arsenic Iodide. Gonorrhea, second stage with continuous tenesmus, destroys the secreting portion of kidneys. Albuminuria and early pregnancy. Throat, red, swollen, painful, intensely inflamed, polar italics. Uvula swollen, swallowing painful, most pain in postnasal, the sharp pain to ear. Pain radiating to ear, copper sulf, alumina, nitric acid, other medicines. Burning pain with great swelling. Nexomica, sour taste and nausea in the morning after eating. Weight and pain in stomach, worse by eating sometime after. Flatulence and pyrosis, nausea and vomiting with much retching, ravenous hunger, especially about a day before an attack of dyspepsia. Region of stomach very sensitive to pressure, epigastrium bloated with pressure of stone. Several hours of eating. Desire for stimulants, loves fat and tolerates them well. Pulsate lies opposite. Backache in lumbar region. Burning in spine, burst 3 to 4 a.m. Cervico-brachial neuralgia, burst by touch. Must sit up in order to turn in bed. Bruised pain below scapula, sitting painful. Materia. Eczema with intolerable itching. Chilliness with the pruritus. Worse in bed. Ulcer, itch and burn, surrounded by vesicles and shining fiery red areola. Bones, especially long bones, inflamed and swollen. Caries exostosis. Pain worse at night. Eruptions ulcerate and form thick scab under purulent matter exudes. This is a case that I have treated with Meserium. You can see the difference within 4 days. The scab formation was there. The patient improved wonderfully, and hair growth also happened. And this is another case. This is a case of atopic dermatitis that I treated with the Meserium. Atopic dermatitis, it affects the flexure regions. You can see the cubital fossa. So extremities, eruption, itching, bends of jaw, elbow. There are 2 medicines, Meserium, and I think other medicine is Cupramet. And anyway, I treated this patient. This is a 6-year-old girl. And you can see neck region as well as the cubital fossa, the improvement. Next is Netromor. Violent fluent coryza, lasting from 1 to 3 days, then changing into stoppage of nose, making breathing difficult, discharge, thin and watery like raw white of egg. Infallible for stopping cold commencing with sneezing. Use 30th potency. Loss of smell and taste. Inclination to perspire easily or dry, rough, cracked skin. Eruption of fingertip, knuckles and toes. Vesicular eruption in patches and circles. Veins full, salts, feet raw and sore. Just a minute. In Netromor, palms hot and perspiring, arms and legs, but especially knees feel weak. Hangnails. Hangnail is a very useful medicine. Other medicines are sulfur. Dryness and cracking about fingernails. Numbness and tingling in fingers and lower extremities. Ankles weak and turn easily. Painful contraction of hamstrings. Other medicine have already told you. Cracking in joints on motion. And Netromor has is very useful as far as skin complaints are concerned, and especially tips of fingers. Netromor as well as Netromcar. So inclination to perspire easily, rough cracked skin, extremities eruption on the tip of the finger, Netromcar in cancer putri. Vesicular eruption patches and circles. Then postnasal dripping, I have already told you about Netromcar. All troubles of external nose, which may attain morbid sized pimples and puffiness. Constant coryza, obstruction of nose. Catarrh, bad smell of nasal secretion. Posterior nasal catarrh. Next is nitric acid. Warts large jagged, bleed on washing, ulcers bleed easily, sensitive splinter-like pains. Exuberant granulations, black pores on face, papules, words on forehead. Loves fat and salt. This is a case of granuloma pyogenicum that I have treated with nitric acid. So you can see the difference. Granuloma pyogenicum is a type of hemangioma, and there will be granulation tissue excessive formation as well as bleeding tendencies. It is usually there will be, especially in fingers, those who are wearing tight rings. So there may be history of irritation or any history of any injury in many cases. In some cases, the patient may not remember also. But in granuloma pyogenicum, this patient I have treated with the nitric acid 200, one dose, and you can see the difference. This is another case that I treated with the nitric acid. Wart in nostril, inside nostril, nose wart inside nostril. Only one medicine is the nitric acid. You can see the difference in the photograph. Within 1 month. In the right nostril, a prominent wart was there, but the wart had disappeared after the medication. Phosphoric acid craves juicy things, sour risings, nausea, symptoms following sour food and drink, pressure as from weight with the sleepiness after eating, thirst for cold milk, eczema of scrotum, tearing pain in joints and periosteum, cramps in upper arms and wrist, great debility, pains at night as if bones were scrapped. Itching between fingers and in folds of joint. It is useful in tinea pedis, phosphoric acid. I have treated few cases, and complaints for sour things. I already told you aversion for sour things, Saramet, phosphoric acid, Belladonna in Kensapat. Then this is petroleum, chronic sprain, fetid sweat in axilla, tips of fingers rough, cracked, fissured every winter, skin dry, constricted, ruggeds worse in winter, diarrhea in daytime, watery, gushing diarrhea. After cabbage and sauerkraut, other medicine is brownia. And regarding phosphoric acid, one more point: it is a 2-mark medicine in pain shoulder left side. And one modality is there, raising the arms ameliorates the pain. I've given the same medicine for in left shoulder pain, and good results well. Then next is picric acid. Myelitis with spasm and prostration, writer's palsy, pernicious anemia, uremia with the complete anuria, prostatic hypertrophy, great weakness, tired, heavy feelings all over the body, especially limbs. I'm making it fast. Plumber metallicum, progressive muscular atrophy, infantile paralysis, locomotor ataxia, bulbar paralysis, important in peripheral affections, paralysis of single muscles, can't rise or lift anything, wrist drop, pain in muscle of thigh. These are the important symptoms of plumber metallicum. Then pulsatilla, aversion to fat food, warm food and drink, rumbling, dry cough in evening and night, must sit up in bed to get a relief, a loose cough in morning, orchitis, pain from abdomen to testicles, stricture urethra. I already told you about other medicine like clematis, petroleum, cantharis, etc. earlier. In Boericke Materia Medica, the word stricture urethra used in Pulsatilla also. In the Arctic area, after rich food with diarrhea from delayed menses, diarrhea during night. China, Pulsatilla, Stonshingar are other medicine for diarrhea during night. Radium bromide, severe aching pain all over with restlessness, better by moving about, chronic rheumatic arthritis, pain, violent cramps, rumbling, pull of gas, pain over McBurney's sponge. Other medicine is appendicitis is subacute appendicitis, iris tenax in Kenstopatry. Sorry, in Borax Materia Medica. The word subacute appendicitis is used in iris tenax. Aching in back of neck, pain and lameness in cervical vertebra, lumbar and sacral backache, severe pain in all the limbs, joints, especially knees and ankles, sharp pains in shoulder, arms, hands and fingers, arthritis, aching pain, bursts at night. Very useful medicine in small joint pain also, like elbow pain, tennis elbow like conditions, shoulder pain, especially night aggravation. Radium bromide in low potencies works wonders. Then next is Rustox, jaws crack when chewing. Easy dislocation of jaw, crustal lactea. I have told you about crustal lactea earlier. It is milk crust. Odd painful swelling of joints, pain, tearing in tendons, ligaments, and fasciae. Limb stiff, paralyzed. Then I have told you about the left-sided complaints of Rustox. Erysipelas static from left to right in keynote. And it is very useful in case of Pancreatitis, especially affecting the left side, mumps affecting the left side. All these are from Kenstopatry. Paralysis, trembling after exertion. And one half of the tongue is spotted in Rustox. Other medicines, Daphne indica. Sepia, herpes resonators on isolated spots on upper part of the body, itching not relieved by scratching, worse in bends, elbows and knees, plasma, herpetic eruptions on lips, urticaria on open air, dry cough, asthma better by rapid motion. Other medicine is lobelia. Feeling of goreness not relieved by eating. Sepia is very useful in fungal infections. Sepia, other medicines, tellurium on intersecting rings, sepia on isolated spot. This is the way to differentiate. 40 to 50 days is the duration of action of this medicine. And complementary is Nexomica, Nectromo, these are the complementary medicines. Then Sanguinaria canadensis, rheumatism of right shoulder, left hip joint and nape of neck, burning in soles and palms. Rheumatism in places least covered by flesh, pain in shin. No, shin is least covered. Cyclamen, carboage, Velcamera, these are very useful medicine for pain in shin. These are least covered area. There is no muscle mass over the shin. Right-sided neuritis, antidote for Rustox poisoning, red blotchy eruptions with burst in spring. Sarsaparilla, emaciated, shriveled, lies in folds. Dry, flabby, herpetic eruptions, rash from exposure to open air, dry itching, comes in spring. Rugged skin cracked on hands and feet. Summer cutaneous affections. It is very useful in summer skin complaints, cracking on hands and feet, and itching on eyelid. Eye eruption, itching eyelid. I think it is on right side. Only one medicine is there. That is Sarsaparilla. Other medicines for graphitis. I think petroleum is also there. I think on right side, only one medicine is there in Sarsaparilla in Kenstopatry. Silesia, disgust for meat and warm food, aversion to meat. Want of appetite, sour irritation after eating, feels paralyzed, fistulae nano, fishes and hemorrhoids. I have already told you rectum constipation before and during menses, Calicarb and Silesia. Constipation always before italics. Phelons, abscess, boils, spot, fistula ulcers, delicate pale waxy, cracks at the end of fingers, painless swelling of glands, promotes expulsion of foreign bodies, crippled nails, nail cripples. Other medicines are Silesia, then graphitis, then keloid. Hello. Just a minute. We'll move on to next slide. Spigelia. Pain in both frontal and temples extending to eyes. Hello. So this is a case, Spigelia in VAR, extremities, VAR, toes. Only one medicine is Spigelia. You can see the difference with the medicine, right? Sulfuric acid in tremor and weakness and craving for alcohol, sour irritation, sets teeth on edge, that is irritation. Strontium garb, I'm moving it a bit fast. Strontium garb, rheumatic pain with chronic sprains, petroleum, and bows are other medicines. Strychnine is a very effective medicine in stiffness of back as well as jaw pain, PM joint arthritis. Then sulfur, I'm just skipping the slides. Syphilinum, especially syphilinum rheumatism of shoulder and asthma in summer. Only one medicine is there in my knowledge in Boericke, Materia, Medica. And asthma in winter, Nexomica, Carbavage, Phalandrium in Kenstrapet. Then Thyroidinum, these are for seeds. Trombidium is a red acarus of fly, is the common name of Trombidium. It is a very effective medicine in dysentery. Very effective medicine in dysentery. Tuberculinum, chronic eczema, I have already told you about tuberculinum, recurrent boils. Singa metallicum, nausea, vomiting, and can't stand smallest quantity of wine, pain in back, and dull aching about the last dorsal or first lumbar vertebra, and lower back pain, aggression by sitting. These are the main features of Singamet, and Singamet is very useful in case of tarsal tumors. Chalazion is very useful. Singamet, I think it is 2 mark. And let us conclude, and now I think we can go to the questionnaire session.
Yes, thank you, sir, for the very enlightening session. We have few questions listed, so I'll read up one by one. First question what we had was, I think it was regarding the urticaria case which you discussed with treated with calcarea. So our one delegate has asked what was the reason for choosing calcarea.
The reason was prescription was constitutional. Okay, based on physical journals, I prescribed the medicine. She was an obese lady with physical journals in favor of chili patient. And am I audible? I hope I am audible.
Yes,
right?
Yes, sir. Yes, sir.
Yeah. So the prescription was constitutional, and I have given medicine in low, that is LM potency in frequent repetition.
Okay, sir. The next question is, are there any remedies for blunt instrument impression?
So have to check. I don't remember, to be frank, right now. Maybe many Materia Medica speeches are there, they may be able to tell at this time. So I'm really sorry.
No issues, sir. So regarding hypothyroidism, you had mentioned regarding a few other drugs like calcarephos, sulfur, and then one delegate has asked regarding thyroidinum. Would you like to?
Regarding what?
Hypothyroidism, sir.
Yes, thyroidinum 3x, I have seen many doctors prescribing, but I have never prescribed. And I generally follow constitutional prescription. And with polycrest medicine, have got good results. So I have not tried. And one more thing, I have seen few patients who have taken thyroidinum 3x from some others. When some of them take by themselves also by reading somewhere, it's the proper results.
Then, sir, this is from one Dr. Anand Jaiswal. He has asked regarding potency, which was used in the acne case treated by Cicuta. If you could.
30 potency. Cicuta 30.
Sir, any general management you would like to suggest for acne vulgaris?
Acne vulgaris, general management, ask the patient to wash the face frequently, use soap or face wash once, and wash face frequently with the warm, preferably warm water, and avoid oily, spicy food. But even skin specialists are having a different opinion regarding the use of oily, spicy food and acne. These are the management that they have suggested.
Okay. Sir, you had shared the photos of the lesions which you treated with Eugenia and also with Cicuta. It seemed it looked similar in picture. So how would we differentiate?
Pardon?
Sir, these are regarding the lesions, the cases which you had shared the photograph of, treated by Eugenia and Cicuta. They
Eugenia, yes.
So they looked similar apparently in the picture, in the photo. So how can we differentiate?
Which photo looks similar? Eugenia and Cicuta.
Cicuta, yes, sir.
See, Eugenia, the main reason is it was a female patient, aggravation during menses.
Okay.
That was the reason I prescribed, and that point I have told you. This is the reason I have Eugenia in that patient.
Okay.
And eruption, red color was also there. And in her case, cheek as well as forehead was also affected, even though I have not given the photograph of forehead. This is the reason I have given Eugenia.
Okay. So regarding the case of urethral stricture, which was treated with clematis, how was the improvement measured? Was it only symptomatic scale which was used for seeing the betterment, or any other?
Actually, after the ultrasound, the residual volume, there was an improvement was there in repeat ultrasound.
Okay. So also one more question from a final year student. In Boericke, there are many rare and less frequently used remedies which are given, but potencies are low and not frequently used one potencies. So how to be sure of potency in such remedy selection?
So that you have to achieve from your experience only. In some cases, for example, I will tell you, in case of the context is a bit different, but in case of hypothyroidism, I told you I am giving 10 nm potency generally. And I have tried with 1 nm as well as 200, but I didn't get good results. But when I tried with higher potencies, including 10 nm, the patient responded very well. So to an extent, it is from your experience. That is what I think.
So there's a case of emphysema where you suggested ammonium carb. Could you share what potency and what changes can be expected after giving the medicine? That is a question.
Symptomatic relief is there in case of emphysema. I generally give it in low potencies.
Sir, are there any specific medicines for cracks in sole, like raggeds?
Cracks in?
Anything from your side? Raggeds in soles of the feet, sir.
So arsenicum, sarsaparilla also. Arsenicum is the only one medicine I think cracks on soles in cancer pulmonary.
So in regarding to BPH, sir, where the symptom of delay in passing of urine, that is, has to wait long to pass urine,
Yeah.
which remedy would you suggest would be acting better? Chimafila, Sabalcerolata, Ferrum picricum, or any other remedy?
See, to be frank, as far as I have treated few cases of BHP with size reduction in the prostate gland. Okay, I generally treat with the constitutional medicines, and in case of acute stages, I give tinctures like I have given Chimafila and all. When the patient is presenting with frequent frequency or burning pain and all. Otherwise, generally I give hypertensive medicines, constitutional prescription. This is the way generally I proceed.
So, were the remedies selected based on only any one symptom, like craving or aversion, or only mind symptoms were considered, like in the case of cracks in sole, that case which you had discussed?
Like a podium you are saying, right? Cracks, like podium was based on the physical journals of the patient, not only based on the one symptom.
Okay.
On the physical journals.
Then this is next question is regarding nitric acid. What was the basis for prescription, the potency, and the dosage? I think you had
nitric acid in one cases I have shown you it is that is VAR in the nose. Okay, it's based on cancerpathy. Only one medicine is there in cancerpathy. Okay, VAR inside the nostrils. Only one medicine is there. That was the reason nitric acid I given it one potency.
So then I'll conclude with this one question, that most of the remedies which you discussed were in correlation to Kent's repertory. So it's a question from our students, what would you suggest, Kent's repertory or Boericke's repertory?
See, I will tell you, generally what I used to do is, I will refer Kent's repertory for a particular condition and read Borax Materia Medica and prescribe accordingly. This is the reason. This is the best way from my experience to improve your knowledge in Materia Medica. Otherwise, for example, for a case of cracks, you will give sulfur or one petroleum. Okay, cracks on soles. There are many other medicines. You refer cancer and see the medicine. What are the 2-mark or 3-mark medicines and read those medicines for Materia Medica. So obviously, your knowledge of Materia Medica will improve. Your variety of prescription also will increase. Otherwise, you will be, for joint pain, you will be using Rastax and Bryonia. For example, I told you about Childonium. From Kent's repertory, I found Childonium is a 3-mark. Then I read Borax Materia Medica. Features are there, I prescribed. So combination of both.
One last question, sir.
Yeah.
How much importance to be given to relationship of remedies? Because sometimes they are often found contradictory also, or even inimical to each other.
From my experience, especially when you are treating dermatology cases, if you are not seeing proper relationship, the case will be spoiled. Especially inimical antidotal relationship medicine, if you are giving as follow-up, it is sure. I have seen many cases spoiled, especially eczematous conditions and psoriasis and all. So I strongly believe there is importance to relationship.
Okay, sir. So with that, we finish mostly all the questions which we got in our chat box. Thank you so much, sir, from all of us here at Father Muller's and from all the delegates who have joined us. And to all the delegates, we'll be sharing the link of the feedback form in the chat box. Please fill that, and following which you'll be receiving the certificate. And also the recording of today's session will be available in our college website, college YouTube channel, Father Muller Homeopathic Medical College, and hoping to see you all in person when we are going to plan our next programs in the near future. Thank you so much, sir, for your valuable time and for the session. Thank you, sir.
Most welcome to the organizers, the principal, HOD, and staff of Father Muller's Homeopathic Medical College. It was a nice experience. I have tried my level best, and thank you for the patient and silent listening. Thank you.